First of all, I would like to thank AIOS to give me the wonderful opportunity to present here. The topic is innovative low-cost dry eye treatment. Now, dry eye is defined as a dysfunction of lacrimal functional unit, which is an integrated system comprising of lacrimal glands, ocular surface, lids, sensory motor nerves which connect them. Most of the dry eye in India is associated with MGD. It is because of the systemic issues like diabetes and the weather here is tropical in nature, the dust and etc. So the treatment modalities which are available right now, it includes topical lubricant drops, anti-inflammatory agents, cyclosporin, steroids, etc. So various device-based therapies have come up in recent years. The two main devices which are in the market, they act by increasing meibomian secretion either by heating and expression, that is LipiFlow, or reducing meibomian inflammation, that is intense pulsed therapy, that is IPL. However, these devices are very costly and hence the cost of therapy also increases proportionally. Keeping this in mind, we have designed an innovative approach to a dry eye treatment wherein a low-cost device is used which provides a similar effect to what a LipiFlow achieves. The purpose of this study is to describe an innovative low-cost dry eye therapy system as compared to a much costly alternative available in the market. The study was performed at an eye hospital in North India, situated in an urban setting. The therapy protocol was designed wherein a low-cost eye heater cum massager, which was easily available on Amazon for rupees 10,000, was used to treat dry eye diseases caused due to meibomian gland dysfunction. The data of 39 patients aged between 43 to 59 years was collected, and of these, 27 patients underwent therapy using the novel device, whereas 12 patients underwent therapy using traditional method of warm compresses and massage of eyelids twice a day. Now this is the eyelid massager cum heater which I used for the therapy. Now this is how the patient wears it. Now what happens here is that this maintains an optimal temperature of about 42 degrees Celsius continuously. So a good massage is, a good therapy of heating is achieved. Apart from this, it has warm compressor at specific points on the lids so that a meibomian massage is obtained. Apart from this, also it has vibration therapy. The device is used for 15 minutes at a time, once every 3 days for 15 days. That is a total of 6 sessions were done in 15 days. And at the end of 1 month and 3 months, the following diagnostic tests were carried out. That is Shermer's test, TBUT, and an OSGI questionnaire. All the patients were prescribed 1% CMC eye drops. The results of these 3 tests were compared with those of traditional therapy group and with values from before treatment. Thus, the low-cost device reduced the incidence of MGD at 1 and 3 months as compared on normal post-treatment Shermer test and tear film breakup time. The traditional treatment group also has significant improvements in their Shermer's and TBUT values, especially at 3 months therapy. The patients in both were symptomatically much better from before therapy. At 1 month of therapy, the patients who underwent treatment with a novel device had much improved Shermer's and TBUT values as compared to traditional treatment group, showing that the novel device treatment therapy gives faster resolution. At 3 months, there wasn't much difference between the two groups. Now, this was the therapy. Now, at mean pre-treatment Shermer's values were something coming around 25 mm. This shows there was a lot of inflammatory watering due to MGD. Now, as the treatment was done with traditional therapy as well as with the device, the Shermer's values decreased at 1 month and 3 months. At 3 months, both the values are appearing similar, but at 1 month, the novel device gave a faster Shermer resolution to approximately 16 millimeters at 5 minutes, which is within the normal range. The TBUT values also increased significantly, showing a resolution in MGD. Thus, this innovative solution is a low-cost dry eye treatment alternative to devices which are available commercially, and thus makes the therapy accessible to a majority of doctors and patients who otherwise would not be able to afford to buy them or pay for their therapy respectively due to financial constraints. Thank you.
What's the name of that massager?
So it's available generically as an eye massager. But what we can do here is that when we connect it to the computer, there is an option that I can modify the time, how much time it can run continuously. Like generically it is running for 5 minutes only. But I changed it in the software to make it 15 minutes continuous running and stopping automatically to make the therapy more.
So does it massage from anterior to posterior or above downward?
Anterior to posterior, so like this.
So idea is to massage the meibomian gland and express out the contents?
Yes, sir. So even with the anterior to posterior massaging, sir, because of heating, the meibomian orifices are loose now. Because the meibomian, the secretions are loose. So when anterior to posterior massage is also done, some amount of secretion will increase.
So how do you do it? Do you keep some tissue paper first, then that
Yes,
device?
I keep a butter paper before putting that, because I have to use the same device for a next patient also. And with the secretions and all, the device will become very oily. So I keep a butter paper first, then I keep the massager above that.
Good, very good.
Ankit, you've done a very nice comparison between your device and traditional therapy. So what was the traditional therapy that was done over here?
Sir, warm compresses and massages. That's what we tell to the patient with MGD. That
And this traditional therapy was done every day?
yeah,
Or
I
did you have a
tell them to
protocol,
do.
or did you have a protocol that that's similar to the machine, once in 3 days?
No. The traditional therapy, I tell the patient to do twice a day for 10 minutes.
So please keep it on silent.
I tell the patient to do twice a day for 10 minutes.
And then why did you decide to do it once in 3 days? Is it purely because of logistic issues? People
The patient will not be able to come daily to me and might not be able to come twice a day to me. So once in 3 days. And what I found after doing for first 15-20 patients, that the device was having the effect for continuously for 3 days. For 3 days, the patient was not feeling too much problem. But then when they started, first I started with daily. When the patient started complaining that it's not possible to come daily, then I started
understand.
increasing it.
What about the type of patients over here? Were they moderate dry eye? Were they severe dry eye?
They were moderate dry eye. So for severe dry eye and the patients with Sitka kind of conjunctive dry eye, this device doesn't work. This device works only with patients who have the dry eye which is associated with meibomian gland dysfunction, that is watering epiphora type dry eye.
The device has been designed by you, or is it commercial?
No, sir, it's not device.
So is it commercially available?
It is commercially available on Amazon, sir.
Good, thank you.
Thank you, sir.